just the awareness, it's timing of diagnosis, and when do you diagnose it, and how do you manage it, how quickly you manage. Literally, this disease is practically completely curable, which obviously our experts will talk, using surgery, using medicine, if picked up early.
Any cancer which is detected early is curable. The problem is that by the time many times the cancer is diagnosed or detected, it is in the very advanced stages, and those are the cases where you are not able to give a solution or a cure. I think so. The most important thing in early detection, as far as early detection is concerned, is awareness. And I think this is a great opportunity. We are all joining together to increase the awareness.
I think it's very important that we as doctors bring about awareness to the society through mediums like you, where you have many people who look up to your content, and we can spread awareness in good quality. Awareness videos can be spread through your content.
In recent times, in the last 3 months, I've had women in their 60s, 70s, early 70s, late 60s who've turned up with lumps which have been sitting there for 3 months. Unfortunately, both of them came out to be cancerous, unfortunately. But fortunately, at least we found out in the last 3 months. And even more fortunately, we have the appropriate treatment for them and a very good positive outlook. So, in this day and age, has breast cancer come to stay in this country? Definitely. And I'm sure both of you will agree with me. From the times that I was a medical student, to a junior doctor, to now, breast cancer is the #1 cancer in the metros in this country.
Nowadays, the trend is towards preventive healthcare than the curative healthcare. Though right from many years, doctors always say about preventiveness, but as patients or the public, we don't even care about it. But now with a lot of things coming up, there's a lot of trend in preventive healthcare, and creating awareness is very important. As a social media influencers, creating awareness, and as doctors, as a healthcare providers, as hospitals, we all are in the game of creating awareness to the public to ensure that these kind of diseases can be treated, detected and treated early, which is very important.
What is the youngest age that someone should start their early detection or screening?
Word screening means looking for breast cancer when a woman does not have any particular symptoms. That is what. So you are looking for early detection even before it produces symptoms. So there are various screening techniques which are available. For example, you can do a self breast examination, you can do a clinical breast examination. There is something called as mammography, and there is MRI. Of all this, the only technique which has shown to accurately detect early cancers and thereby improve the survival or reduce the death rates is only mammography. Mammography is the only test which has shown that it can detect cancers accurately, sufficiently early, so that it results in improvement in lives.
How our body know that, like giving any signals like we are started to developing a breast cancer?
So with breast cancer is the development of a lump. Most commonly it is a painless lump which is progressive in size. Apart from these, patients also can develop with any changes in the nipple, any indrawing of the nipple, or the skin overlying the breast could get indrawn. That's called as puckering and dimpling of the skin. And if women allow it to stay for a longer time, then there could be some skin changes as well. It's very important that women know and feel how their breast is, so they keep doing their regular self-breast examinations.
Is this cancer, breast cancer, is only for a woman or men also get it?
No, breast cancer is not a disease only of women. It can happen in men as well, though the incidence is very low. It's about 0.5 to 1% of all diagnosed breast cancers. So let's say if you're diagnosing about 100 to 200 breast cancers in women, 1 or 2 may turn out to be breast cancers in men. The reason being, men also do have a little bit of breast tissue, though it is rudimentary. Rudimentary means it does not function like it's normally supposed to. Though it's rudimentary, it's still there.
like if somebody is having lung cancer, right? So is there any chance that they can have the breast cancer also, if I am talking about any lady?
So certain cancers have a specific tendency to spread to certain sites. For example, a lung cancer commonly spreads to liver, to bones, adrenal glands, to brain. So breast is a very uncommon site for a lung cancer to spread. For example, if you take the breast cancer in the advanced stages, the breast cancer commonly spreads to bones, liver, lungs, brain. So different types of cancers have a tendency to spread to specific sites. Breast as a site for metastasis or to spread is an uncommon site.
I know is prone to cancer because they have a family genetic history. In case like my grandmother has recently operated with a breast cancer. Now I'm aware of it, my family condition. So is there a certain set of measures which I should be taking from right now? May that be lifestyle changes, or if there are any other factors which I should be considered right now, because I cannot get the mammography or something, get it done. Maybe my mother can get it done, but I cannot do that directly. So are there some preventive measures which I should be concentrating on for now?
That increases the risk of breast cancer, but which are in our hands. Correct. We can decide to have multiple children, we can decide to have the first child maybe before the age of 30, we can decide to regularly exercise, we can decide not to have oral contraceptive pills. Hormone replacement therapy is something which is done by women once they attain menopause to get relief from the postmenopausal symptoms. So you can decide to have not to have hormone replacement therapy, you can decide not to smoke, you can decide not to consume alcohol. So these are modifiable. So wherever there is a modifiable risk factor, we can always try to modify. But as I told, there are a lot of non-modifiable risk factors which we are born with, which we are unable to. And that's why I told that there is no absolute way of prevention. But something which is in our hands, we can always do.